Hello, welcome to another episode of Arthritis and You, a joint journey. Today, we've got something special lined up, so buckle up because it's time for the deep dive. Let's give a warm welcome to our hosts, Arthur and Sarah.
You know, in a world just overflowing with information, especially when it's about your health, something so vital, it can feel like, well, where do you even start? Wouldn't it be great to have a guide, like a shortcut to get right to the heart of what you actually need to know? That's really what we aim for here on the deep dive. We take the sources you give us, articles, notes, research, and we distill it all down. We pull out the key stuff just for you so you can feel genuinely informed and quickly too. Today, we're diving into a really important medication called Rituximab. It's a big deal in rheumatology, used for some complex autoimmune conditions. Our mission really is to unpack what Rituximab is all about, using your source material. We want you to understand what it is, how it works, and, you know, the important things to consider. And there are some fascinating things to uncover here, like how it targets very specific immune cells. It's quite elegant, actually. Or how much better it can work when used with other treatments. That often surprises people. But let's just jump right in. What exactly is Rituximab? Where does it sort of fit in the medical world, particularly rheumatology?
Okay, yeah. Rituximab is what we call a biologic. And when we say biologic, we mean it's a medication made from living sources like cells or proteins. They're often designed to interact with specific body processes. It's part of this, newer and really significant group of drugs called disease-modifying anti-rheumatic drugs, or DARDs.
DARDs, right. I've heard that term.
Yeah, and it's a key term. These aren't just masking symptoms like pain or swelling. They're actually designed to slow down or maybe even stop the disease progression itself. You protect joints, protect organs.
So it's about tackling the underlying problem.
Exactly. Now, Rituximab is a biologic, like, say, TNF antagonist you might have heard of. But it works very differently from those. Its main use is for inflammatory arthritis, especially rheumatoid arthritis, but we also use it for quite a few other autoimmune conditions in rheumatology. And you can get it as the original brand name drug, or there are also 3 biosimilar versions available now.
Biosimilars, meaning they're like highly similar versions.
That's right. Very similar, shown to work just as well and be just as safe.
Okay, that makes sense. So understanding it's a biologic, but a distinct type of biologic. Let's get practical. How is it actually given to a patient? What's the usual dose?
Right. So it's given as an intravenous infusion. That means directly into a vein, usually in your arm. The infusion itself typically takes a few hours each time.
Okay, an IV drip.
Correct. And the standard approach is a course of 2 infusions. Each one is a 1,000 milligram dose.
1,000 milligrams.
Yep. And those 2 infusions are given 2 weeks apart. So day 1, then 2 weeks later, day 15, roughly.
Got it. And after that initial course?
After that, it's usually given again, but the timing varies.
Yeah.
Generally somewhere between 6 and 12 months later. It really depends on how well it's controlling the disease for that particular person.
So it's tailored somewhat?
It is.
Yeah.
And that brings up something really important patients ask.
Yeah.
How soon will it start working?
Yeah, that's the big question when you're feeling unwell.
Absolutely. And with Rituximab, patience is definitely needed. It's not like taking a painkiller where you feel relief quickly. It can actually take at least 3 to 4 months, sometimes longer, before you really start to notice a consistent benefit.
Wow, 3 to 4 months. That's quite a wait.
It is. And it's something physicians need to discuss upfront, managing those expectations, because waiting can be tough when you're dealing with active symptoms.
Right. Managing expectations is key. But that delay makes me even more curious. How does it actually work? What's happening inside the body during those months? You mentioned B cells earlier.
Yes. This is really the fascinating part, the mechanism. Your immune system is incredibly complex.
Right.
Lots of moving parts.
Definitely.
What's clever about biologics like Rituximab is their precision. They don't just flatten the whole immune system. Rituximab targets a specific type of white blood cell, the B cell. Think of B cells as, key players.
Yeah.
They make antibodies. But in autoimmune diseases, they also contribute significantly to the inflammation process.
Okay, so they're involved in the problem.
They are. Rituximab works because it finds and binds to a specific molecule on the surface of these B cells. It's called CD20.
CD20.
Exactly. By latching onto CD20, Rituximab essentially flags these B cells for removal, or it neutralizes their activity. This reduces the number of those specific active B cells, which helps rebalance the immune response. The result: less inflammation, less pain, and better physical function for the patient.
That sounds incredibly targeted, but hang on. Don't we need B cells? Like, for fighting infections, aren't they crucial? It sounds a bit risky targeting them.
That's an excellent question, a
Yeah.
really common one. And you're absolutely right. B cells are vital. They make antibodies. They protect us.
Right.
But here's the really smart part, the nuance. Rituximab targets CD20. And while CD20 is on most B cells,
most.
yes, it's not found on the very early immature B cells still developing in your bone marrow. And crucially, it's also not found on the fully mature, long-lived plasma cells.
Plasma cells.
Those are the cells that are the real antibody factories, responsible for your long-term immunity memory, the immunity you've already built up.
I see. So it's hitting the middle ground.
Precisely. It targets the B cell populations that are often driving the autoimmune inflammation, the ones causing the trouble right now, while largely sparing the cells needed to make new B cells and the ones responsible for your existing antibody protection.
So it dampens the problematic part without completely disabling your defenses.
Exactly. It's a much more, let's say, surgical approach than just broad immune suppression. It allows for control of the autoimmune condition with only a mild overall suppression of the immune system.
That is clever. Okay, so understanding that precision, let's think about someone starting this. Does taking rituximab mean they can just ditch all their other meds? Or is it usually added on?
Yeah, another great practical point. And generally the answer is no, you don't just stop everything else. In fact, most rheumatologists will strongly recommend continuing with at least methotrexate, assuming the patient tolerates it okay.
Methotrexate, okay.
Right.
Why is that?
Because the studies are really quite clear on this. Biologics, including rituximab, just work significantly better when combined with methotrexate.
Better how? Like more effective?
More effective, yes. And the disease control tends to last longer. It's a synergistic effect. The combination provides a more powerful attack on the inflammation. Think of it like a 1-2 punch.
Makes sense. So the goal isn't just to add rituximab, but potentially to use it alongside existing treatments for maximum impact.
That's generally the initial strategy, yes. Remember, if a biologic like rituximab is being considered, it's usually because the current treatments, maybe including methotrexate alone, aren't fully controlling the disease. So the primary goal is to get that disease under the best possible control first. That often means staying on all your DMARDs for a while until things are stable, before even thinking about carefully reducing anything.
Get it under control first, then optimize.
Exactly. And just a practical note here, if you do happen to miss a scheduled infusion for some reason, it's really important to contact your doctor right away to get it rescheduled appropriately.
Good tip. Okay, so we've covered what it is, how it's given, how it works, and how it fits into a treatment plan. Now, the crucial part, safety.
Right.
What about side effects and precautions? What should people know?
Right. Safety is always paramount. With any medication, especially biologics, you need to be aware of potential issues. For rituximab, there are a few key things. First, infusion reactions. These can happen during or soon after the IV infusion.
What kind of reactions?
They can range. Mild things like a headache, maybe some nausea or rash. But sometimes they can be more severe, like difficulty breathing or a drop in blood pressure.
That sounds serious.
It can be. If a severe reaction happens, the infusion is stopped immediately, of course.
Yeah.
But the good news is, for future infusions, we can often give pre-medications like antihistamines or steroids beforehand to prevent it from happening again. So it doesn't necessarily mean you can't continue the treatment.
Okay, so there are ways to manage that. What else?
Another major consideration is an increased risk of infections, sometimes serious ones, particularly lung infections like pneumonia.
Because it affects the immune system.
Exactly. Even though it's targeted, it does modulate immune function. So this is really important. If you feel sick, if you get a fever, a bad cough, anything that suggests an infection, especially around the time an infusion is due, you absolutely must tell your doctor right away.
Don't just tough it out.
Definitely not. They might need to postpone the infusion until you're better. Ignoring fevers or serious illness while on rituximab is not a good idea. Prompt communication is key.
Got it. Any other specific risks?
Well, there's an extremely rare risk of a very serious viral infection affecting the brain. It's important to know about, even though it's highly unlikely. Your doctor will discuss it.
Okay. Rare, but noted.
Skin reactions can also occur, sometimes even weeks after the infusion. So any new rash, itching, skin changes, report those to your doctor too.
Weeks later. Interesting.
Yes. Also, if you have a history of viral hepatitis like Hep B or C, it's critical your doctor knows before you start rituximab, as there's a risk of the virus reactivating. Specific monitoring might be needed.
Okay. Important history to share. Anything else? Medications.
Yes, always tell your doctor all the medications you take. but specifically mentioned blood pressure medications, as there can be interactions that need watching.
Good to know. What about vaccines? That often comes up with immune-modulating drugs.
Absolutely crucial point. Live vaccines, things like the MMR or chickenpox vaccine, should be avoided while you're on rituximab and for some time after.
Why is that?
Because your immune system might not respond normally, and there's a theoretical risk the live virus in the vaccine could cause problems. Ideally, any needed live vaccine should be given before starting rituximab.
Plan ahead with vaccinations.
Exactly. Really, you should discuss your entire vaccination status, past and future, with your rheumatologist. They can guide you on what's safe and when. And, just to reiterate the standard advice, for any detailed information or questions really specific to your own situation, you should always talk directly with your physician. They know your full history.
That's always the bottom line, isn't it? Talk to your doctor. Wow. Okay, that was incredibly thorough. We've really unpacked rituximab, what it is, that clever CD20 targeting mechanism, the practicals of dosage, that important delay in effect, combining it with methotrexate, and all those crucial safety points and precautions. Our goal was that shortcut to being well-informed, and I really hope you, listening, feel more empowered now.
It really is quite something, isn't it? When you think about how precisely rituximab targets those specific B cells. It does make you wonder, doesn't it? What does the future hold for treatments that are even more targeted? Could that kind of precision completely change how we approach treating these complex chronic diseases down the line?
That's a fascinating thought to leave people with. The potential of ever-increasing precision in medicine. Quite exciting. Well, thank you so much for joining us on this deep dive. We really hope you feel much more informed and empowered with this knowledge.
This has been another episode of Arthritis and You, a Joint Journey, brought to you by the Rheum team from albertarheumatology.com, your trusted evidence-based suite of resources available 24/7. Straight from Alberta, but for folks around the world. Our hosts today, Arthritis and Sarah Upas, technical producer, John Ifan, and our executive producer, Stephen Gates. While we work hard to maintain the accuracy of our information, we accept no legal responsibility for any errors or omissions. Remember, always check with your own physician first. Join us next time for another Deep Dive.